Hi guys, I am Dr. Ramakrishna Chaitanya, consultant anesthesiologist, critical care physician and anesthesia faculty. So in this video session, I would like to tell to the students how it would be if they opt anesthesia in the forthcoming counselings. Right? In this session, as we all know that All India counselling has been done and many students are waiting for the state counselings, and they have been allotted or they are probability of getting allotting anesthesia in their states or in the All India quota. So many students are asking me to tell or to discuss about the pros and cons or how it would be like if they opt anesthesia as their career option. So in this video, I particularly concentrate on pros and cons of the anesthesia session. So this is my first video that I am making, so I am putting it on the social media. I am really excited to tell about anesthesia because I know there is no curriculum for anesthesia in undergraduation days. You might not have read it about anesthesia, or I also know obviously many students don't attend anesthesia postings during their internship. So many students have really a lot of confusion how it would be or what are its things, what is happening in the residency period of anesthesia, how the life it would be. So I'll try to clear off the confusions. Okay, so what I do in this session is particularly I will tell the pros and cons of anesthesia. I don't like to use the word pros and cons of anesthesia. Why? Because for every coin there are two sides. In the same way, for every branch there are two sides. One is a good side, one is a bad side. We feel it is bad, but it's obviously that side of the branch. So for the convenience, okay, I'll make it very simple. So I'll talk it in the terms of pros and cons. Okay, so when I wanted to prepare this video, interestingly, what is the question that was asked by one of the students 2 days back? He messaged me and he asked me a question saying that, sir, whether anesthesia was your choice or have you taken anesthesia by chance? Now this is a very really interesting question. So before starting the session of pro and con of anesthesia, what I will tell is why I have chosen anesthesia as my career option. Okay, so I completed my undergraduation in 2007. December was the last day, December 31st. I have finished my internship, and in March I have given my entrance examination. So at that time I was eligible for the state counselling only. We had only state counselling. So with that 3 months of preparation, whatever the preparation I have done, I got a rank of around 300 or 350, somewhere around 300 and 350. So that's not a very good rank because that's at the same time that's not a bad rank also. 50,000 students appear at that time. So whatever the preparation I have done, so this was the rank which we consider in those days as a borderline rank. That means I am stuck up in between whether to drop for a next year or to take the branch whatever it comes to me. So like you, I was also sailing in the same boat. So I had also made the same thing. So I went and asked many of my friends, many of my seniors, many of my professors. I have started asking and I have collecting the information from the respective departments because I wanted to make sure like which is the best branch for me or whatever the thing which is coming to me, what to do. I was really confused because from my undergraduation days, I never had a thought that I will take or this is the branch I wanted to take. During my preparation also, I never felt like I want to this branch only. I was like something like a neutral guy or just like an ordinary guy. I was like, whenever I was reading medicine, I liked medicine. Whenever I was reading OBG, I liked OBG. Whenever I was reading pathology, I liked pathology. So I had no positive opinions or negative opinions, but the real problem for me started when I got a borderline rank. So many students or many of my friends, they said like to drop, or some said like the competition is going to rise, why are you dropping it, it's a foolish decision, take the branch. So I was consulting, as I said you. So in meanwhile what I did was I have asked one of my senior, okay sir, which branch he has to take. So he has made it very clear to me on that day that he said, see Chaitanya, there are like these branches, they are existing before you come to the medicine, they exist after you leave this medicine also. Fine. So there is nothing like a good branch or a bad branch. It all depends on the caliber of the student. Now this is the word which has struck me. I liked that word very much. That was the life-changing word for me. So he said only simple thing like you should be excel in whatever the branch you are going to take. So like this in common words, what we call it as branch में नहीं बंदे में दम होना चाहिए. So if you are having the real capacity, whatever the branch you get, yes, definitely you will be try to be in the top position, and that creates a difference. Because I have seen, as I said you know, I have passed in 2011, so in my 9 or 10 years of my professional career, I have seen so many toppers at the same time, so many normal students who has got some branches, and some are doing exceptionally well in their private practices. Some are, even though they are toppers, they are like, you know, they don't have that much. I have seen that, I have seen the clear cut difference. So I strongly believe in this factor that you should have that caliber. Okay, now coming to that same point, you know, I asked the same thing. So with that statement, I went to the counseling. So in those days, what happened, you know, we didn't had this allotment. We used to go to the university, we used to stand there, and somewhere or other they used to call, and they used to distribute the seats like this. So I had an option of general surgery at private colleges, ENT, ophthal, psychiatry, and anesthesia. So I didn't had any option. So that only one thing was running. As I said you know, branch mein nahi, bande mein dam hona chahiye. So I have opted like anesthesia for me. So I thought that's a good branch. No one has, like, you know, some people said discouraged me, some people has encouraged me, whatever it might be. I was like quite a bit happy for me. So I was nothing personal or nothing like that. So on the first day of my residency, I went to the department. I was really excited. The whole day I was standing looking at some surgery, something was going on in the operation theaters. That much time I have not spent during my undergraduation days or during my residency period. I know it very well. I used to stand there in the operation theater whole day. I have standed, and I was watching the things going on. And in the afternoon session, we had a meeting in the department. So all the new residents were introduced to the department. My professors, the rest of the professors, HODs, and the associates, they came to the department. So we had nice lunch at that time, and we started this introduction. All were introducing, you know, whole day I have worked. So what happened, it was very clear from my side that I was slightly dozing off. Okay, so what happened, I selected my chair. It was midsummer, I still remember the AC room was there. So nicely I have selected one corner chair, and I was slightly dozing off like this. So all were introducing. It was a boring introduction, yeah, what to do, how we do, what we do, or, you know, everyone was telling their ranks. Like, I didn't like that, so I was slightly dozing off. So my professor and HOD, a very great person, you know, the very respectable person also. So he came, he took the mic, and he asked one question to all of the students sitting there. He asked, like, how many of you have taken anesthesia by choice? So as I was sleeping, I was not completely sleeping, I was slightly dozing off, right? So I thought, like, you know, someone was asking and everyone would raise their hand, and I lifted my hand like this. That was the first blow. No one has lifted my hand, and my professor has noticed it. So immediately he asked me to stand up. So I was like, you know, first day, imagine my situation, first day, and in the department, directly in front of my professor and HOD, and he asked me, very good, introduce yourself. I said, I am Dr. Ramakrishna. So anesthesia was choice because there was no other option for me. So my professor asked me a very simple question: what was your reason for taking anesthesia as your career specialty? You know, I don't have any, seriously, I don't have any option for me, because as I said, I am a neutral guy. So for me, like, I can't say all these stories to my HOD. He will laugh at me. So I don't know what to tell the first day, and this is what happening to me in the afternoon session. I was cursing myself. I don't know what to tell. So immediately one thing that struck to my mind was, I said, like, you know, sir, I like the blue scrubs. Simple. Okay, I will be very frank to you, right? So I said, I like the blue scrubs, I look cool in that blue scrubs, something like that. So I wanted to join anesthesia. My professor, things were on a lighter moment at that time, and my professor laughed at me and he said, fine, that's fine, you have one good reason to join anesthesia, but whatever the reason, it's not, you will not be repenting of the decision what you have taken. He was laughing at me, and everything was on lighter mode. So that was the first incident. So the first advantage for the students, on a lighter note, I am telling you, for a student who is lazy like me, who don't want to do shoppings and all this stuff, believe me, it's quite some normal, because you will be whole of my 10 years of my career. So I was wearing only blue scrubs, dark blue scrubs, navy blue scrubs, all kind of blue scrubs. Okay, so that was the only thing. That's like, you know, that's on a lighter note. Now, once I have told you the lighter note, I will seriously discuss about the anesthesia pros and cons. As I said, you know, pro. For every pro, I will tell a con, and I will also tell you a remedy for it, so that you will understand how to look at the branch. My aim is not to judge any branch on this session. because if you want to copy me, it will be a utter disaster. You can't copy me, or I can't copy you, in the other words also, because whatever might be my thinking, whatever might be my perspective, it is not obvious that you should not be like this also. You have a different set of things, and you have a different social circumstances and all these things, so you have to make the decision. My aim in this session is very simple: to tell what is there. You have to make a call, and you have to believe that whatever you have taken that call, it is for your good only. Okay, so with that start point, making that highlight point, so what I will do here is I'll tell you the pros and cons of anesthesia. So what is the biggest pro? What I like very much in my department of anesthesia is, the first and strongest point is, it gives me an immense amount of clinical satisfaction. Anesthesiologist, whenever the things you might have seen in your hospitals also, whenever the things are going in a chaotic way, whenever there is an emergency situation in the hospital, the only one person who is be looking upon will be the anesthesiologist. So what happens, you might have seen myocardial infarction, you will be seeing in your, I'll tell you my own experience. I have seen so many patients with MI landing up into ventricular fibrillation. I was there, I have given the shock, they have walked out of the hospital smilingly. So that is what it gives me a pleasant sleep in night. Whenever one more incident, you see a chubby child, everyone was trying to put the cannula, the child is crying, the mother is crying, the parents are crying, nursing staff, everyone is there. They call upon the anesthetist, he comes and he taps the hand, you keep an IV cannula, the mother, she remembers your face. That's one thing, that likes me, or it gives me a lot of clinical satisfaction. Not only handling the emergencies, so small things, starting from keeping an IV line, if there is a problem in tracheostomy, if there is a problem in passing an NG tube, whatever it might be, the first person, if I am there in the hospital, my hospital will be having a nice pleasant sleep, because they know that this guy will manage all the things. So it's not about my greatness, it's a department, what the training that gives you in your department. This is the greatness of the department. So anesthesiologists are trained to handle the emergencies. Okay, the anesthesiologists are trained to handle the emergencies. So you will be feeling like, kabhi kabhi apan ko lagta hai hum bhagwan hai, like the famous dialogue of one of the web series, right? So you will be having that level. So that's a very good point. You will have a lot of clinical satisfaction. So this is one strong point which I tell it as a pro, right? The second point, very important point, the financial stability. Many students, I personally like this point also, because it's not about only clinical and all these things. What is the point if I don't have money? So I'll tell you, in my city, that's Hyderabad, where I come from, it's a pretty decent, like metro city. So the freshly passed out graduates, after finishing off their MD, my hospital itself, it will offer around 1 lakh on an odd, they will give you 1 lakh. I found no other speciality would offer you that much for a fresh graduates also. So that's a very strong point, financial stability. Whatever you do, if you have financial stability in your life, this will make your life awesome. Fine. So financial stability is one of the strongest point in anesthesia, where you start earning very quickly. So for a master degree, I said you start earning very quickly, and this is one of the strongest point which I like in anesthesia. Fine. The third one, many students, they come to the department keeping in mind, no one wants to become an anesthesiologist. I will be free and frank to you only, right? So they might be thinking like, I will become a medicine guy, or I will become a OBG guy, I will become a pediatrician, something like that, So for those guys who have some other plans, and plan B was anesthesia, I will assure you, or you can be assured after taking anesthesia, that whatever was your dream, it can be satisfied by taking anesthesiologist. Okay, how? I'll tell you. So you might be liking medicine, right? So you wanted to become cardiologist in your, that's a fancy term, right? So you might want to become a cardiologist in your future. So what you can do after doing anesthesia is, you can really become a cardiac anesthesiologist. That's a very good point, right? So you like pediatrics. I can say you like, you want to become a pediatrician, but unfortunately you got, fortunately or unfortunately you got anesthesia. You have opted it. Now you can dedicate or you can concentrate more of your energy on pediatric anesthesiology. There are dedicated units for it. Sir, I wanted to become a surgeon. Definitely you can become a transplant anesthesiologist. Sir, I wanted to become a critical care physician. That's also fine, because I wanted to open up my own setup. You can't open it officially. It's like, that's like, if someone asks me, do you have your own setup? I say no, because I have been working in critical care units. So once you are working in critical care units, it doesn't matter whether you can see OP. It's a very small thing. You see myocardial infarction. Don't you think you can treat any viral common cold or something like that? Yes, you can easily treat it. So it's not about whether I can run an OPD or not. But a very important point I can tell you is, if you are running a critical care unit, if you are heading a critical care unit, or if you are working in an ICU, cardiac unit, nephro unit, whatever it might be the thing, so you will not, there is no point for you to work or to set up your own OPD. Still, sir, I want to open up an OPD. This is not a big deal, right? This is not a big deal, provided you know the basics of communication, and might not be in tier 1 cities, but in districts and talukas levels, you will become a good physician. When in our country there is a lot of scarcity, when you compare to these RMPs and PMPs who are practicing, quacks who are practicing, you would be a much better person. Definitely you would be a much better person, because you have lot of ample of exposure, and treating this common cold or cough, URTIs, that doesn't matter to you at all. Fine. So that's the one point which I like about anesthesia, is anesthesia has got extensive ramifications in various other branches. So you can choose your point. Sir, I don't want to do anything, I wanted to become a surgeon. Nothing was running in my mind. So what you can become in future is anesthesia. It can offer you something like pain physician. You can do interventional procedures. You can relieve the pain of the patient. That's an awesome thing. That might be the changing thing, that might be the changing trend. I'll talk about the trends of anesthesia or whatever it might be in the other session. So let me tell or concentrate here more on pros and cons only. Okay, so anesthesia has got extensive ramifications. Now this can satisfy your ego, might be whatever it might be. I want to become OBG, but I can't become an OBG guy. So what you can do is, you can practice obstetric anesthesia. So in that way, anesthesia has got extensive ramifications. The fourth point, sir, what, sir, every day studying, since 7 years I am studying, after 3 years, every day I don't want to study. I want to, once for all I am done. Once I am done with, because there will be some students like me who don't want to read. Obviously, everyone don't want to read. I like to read actually. So some students, they really feel like, what, sir, after 10 years of study, every day you are talking about study. So I want something like, once I am done with my MD degree, I don't want to read that much, sir. I want to have my own practice. I don't want to read. So for those also, I have a solution in anesthesia. I know if you go to interiors, because our profession is in somewhere or other in such a way that if you don't read, that means you will be extinct. You will not be in pace with the changing trends, right? I know it. You also know it. But somewhere or other, we are carried away with our works. So for those students, I will tell you very seriously, if you don't want to read, or you want to go to tier 2 cities or districts or talukas levels, I know many of my anesthesiologists, they if doing one spinal anesthesia, that is sufficient at a district level. I don't say you have to be a cardiac anesthesiologist, you have to be a pediatric anesthesiologist. So the basic stuff, that is sufficient for your survival. And I know many people who are living at the district levels or in the town levels, they are earning much more than me. I can very strongly tell to you that, they do only spinal anesthesia. Whatever there might be the procedure, they will think of only spinal anesthesia. Apart from spinal anesthesia, since 20-25 years, nothing was they are practicing. They know only spinal anesthesia, and they will do most of the times either cesarean sections or hysterectomies. But the amount they earn, it's awesome amount they are earning. So you can be assured, provided it's I don't say you don't have to read, or it all personal dependent. Some students, they don't want to, that's fine, is fine. I am not judging anyone here. Still, for those also, there is an option in anesthesia, because my professor, one of my consultant used to say that for a surgeon, there might be 10 number or some surgeons in your town. So out of all surgeons, only 1 or 2 might be famous in your town, right? You might be knowing that. But out of all anesthesiologists, every anesthesiologist is famous. Might not be in the public domain, but in the surgeon's lemons, there will be one famous. There will be, all of them are famous anesthesiologists, because we have some routine stuff which we can do and we can get over the things. So that's the biggest advantage of anesthesia, is for those who want to read extensively. We have got extensive branches like cardiac anesthesia, pediatric anesthesia, and all these stuff. For those who don't want to read, it's also fine for them, because you can do spinal anesthesia and you can get off. You can put the tube and you can get off, do some normal general surgical procedures, and you can earn a decent enough life. Fine. So this is one of the advantage of anesthesia. Coming to the next advantage of anesthesia, anesthesiologist is a branch where whatever the place you are residing, definitely in your life you will be facing some sort of emergencies. So definitely when you are facing an emergencies in the whole of the hospital or in the whole of the medical fraternity, there is no other guy who can capably handle these emergencies. That's the anesthesiologist. We are trained to handle these emergencies. So whenever the things go in a chaotic way, you will do the work in an organized way. So most of the times, whenever there is a cardiac arrest, when there is massive bleeding, whatever might be the situation, you will be there leading in front. Sir, what is the advantage here? The advantage I will tell you. Now, I strongly believe that our life, our personality in our life, it's strongly dictated by the terms how we work in the hospital, right? Because most of the times, 70% of our time in a day we spend in our hospital. Now, if you know how to handle an emergency in a hospital, then imagine how would you handle your normal day-to-day things. You will be a well organized person. You know the difference, you know exactly what to do in case of emergencies, when it is not, what to do when it is not. That's, you can have a perfect work life balance, which is very, very essential for a student or for any person who is leading the life. In the coming future, you will understand what I am trying to say. It's a work life balance. You can maintain these work life balance discipline in your life, provided you know how to handle these emergencies. Okay, so that's one of the strong point. I have seen, many residents work under me. I have seen these residents when they are doing their undergraduation, during their residency. I have seen, particularly I remember one girl, she used to be like very shy, very timid. Whenever there was a group of crowd coming to that girl, she used to run away from that situation. She has taken anesthesia. After finishing her anesthesia, she was working in a private firm. Now I have seen her convincing the patients and the attenders. There were a mob of 10 to 15 crowd surrounded by her, and she was solidly standing in between and was convincing everyone in that mob what is happening to the patient, and everyone was satisfied with it. Now this is the impact of anesthesia training on her. I can really correlate that thing. From seeing her only, I have realized that this is what anesthesia has given to me. Fine. The second one, the next important advantage, which I personally feel a very, very strong advantage. Sir, I want to go abroad. Somehow or other I am stuck in this country. Now I can assure you, for those guys who are thinking to go abroad, anesthesiologist is the best option for you. Yes, I am telling it very strongly, because I myself have been offered a job in other countries where, Middle East and all these countries, definitely you have a scope. Definitely UK is one of the place. UK, Italy, Germany are those countries where they require, any branch they require to learn the language. But UK is a country where they can take you off with Indian degrees, with a normal formal training after 3 years of your post graduation. Yes, you can have better opportunities abroad. Leave about US, because these US guys, unless you write these MLEs and steps, you are not entitled to go there, get fellowship. But definitely in anesthesia in UK, Middle East countries, and the amount of payment what they offer you in Middle East countries is 3 to 4 times more than what you are earning in this country. So if you go there, stay there for 5-7 years, now you can imagine how much amount of money you can earn. So that's also a part and parcel of your life. So going abroad, you have a thinking, you want to do critical care, because you might be seeing in this recent pandemic, that COVID episode, what is happening? Everyone is looking at the critical care physician. There are no critical care physicians. So you can understand what is the role of a critical care physician. So you can easily correlate that you can have a better, provided you are good at your academics. Definitely that's part and parcel of it. So you should be understanding that if you want to go abroad, anesthesiologist is one of the best branch. Fine, sir. What is the other advantage? I'll tell you, sir. I don't have any other thing, sir. I just wanted to open up a hospital. I wanted to open up a hospital at my district or town level. What should I do? Yes, again anesthesia will help you, because anesthesiologist is trained in such a way that I can go to general surgery department. I might not be a master of general surgeon. I can go to OBG department. I can go to nephrology department. Why, sir? Why are you going to nephrology? I put a dialysis sheet. I know how to initiate a dialysis. I can do an ultrasound. I am trained to do a fast ultrasound. I can handle my emergencies in case of trauma. I can know what is a massive blood transfusion protocol. I know to put a airway. So all damn things, emergency things, I know. So now imagine you are master of all these emergency stuff. Now can you open up a hospital? How easy it would be. And you know what is exactly happening in each and every department. That's the beauty of anesthesia. I feel like those who guys are planning to open up a hospital or partnering with some persons in future to open up a hospital, definitely anesthesia is a good branch, because you know what is happening in and out. I will reiterate here one more time that if your hospital has to run in it has to run in huge profits, definitely you should have a very good backup of anesthesiologist as well as critical care areas, because these two areas, OT and ICU, these are the only areas where you can generate income. So obviously if you are the head of these OT or ICU, definitely, and this is your own hospital, you know how to conserve the money, where to spend wisely, and your hospital will be running enough profits. So definitely these are all a set or bunch of advantages which you can't deny. You can't say like, sir, this is not applicable. So it has like, like any other branch, anesthesia has got extensive advantages also. Right. So always you are talking about anesthesia advantages. Why don't you talk about anesthesia disadvantages? Okay, fine. For you guys, I'll tell you the disadvantage. And simultaneously, I'll tell you how to overcome it or how people have overcome it. Right. So the first thing what I said in advantages is anesthesia will give you good clinical satisfaction. Right. So what is the con of it? The other side of the coin. You can see when I say clinical satisfaction, that means I have to handle lot of stress. Obviously, anesthesia, when you compare to other branches, it is slightly stressful branch. Sir, how, sir? I am not trained. The whole of your post-graduation curriculum is meant to handle these emergencies. When you bend your spine during your post-graduation days, definitely you will have a better life in your future. Right? So, what will happen? Your anesthesia training will be in such a way that you are trained day to day. If you ask me, sir, are you in stress? I don't have a particular answer, because when I am going for a case, suddenly suppose if someone calls me for a case of acute appendicitis right now, when I am going there, I will make up my plan. I have my own plan A, plan B and plan C. Now if it is like routine plan for me, I go and give the case and come out, take my money and come out of the hospital. That's fine. I don't, somewhere or other, if someone calls me for cesarean section, I go and give spinal, I take the money and come back. That's it. The story ends there. Suppose if it gets complicated, again I know how to handle it. It's not so stressful for me, but simultaneously I can't deny that whatever the things that happen in the hospital, that might impact me at some point or other. But the whole point is, if you have got a good amount of training, obviously I feel that you know how to handle the things. You will not feel that much amount of stress. Like in the beginning days of my post graduation, I used to feel like what will happen if I can't put the tube into the endotracheal tube. Now I know how to handle. After 10 years of my service, I can really tell what to do, or I have a plan what to do if the tube doesn't go in. So you will be trained and it will become part and parcel of you. I don't consider stress really as a part and parcel of it. For the matter of fact, even the surgeon also, like he will be also having a plan A, plan B, plan C. So if the plan A doesn't work, he also goes to plan B. And switching to plan A to plan B, for everyone it is a stressful part. Okay, so I don't personally think that but for students who want to have a very cool life, definitely sir, I don't want to take up all these stress and all these things, so definitely I will tell them this anesthesia might not be your cup of tea. Okay, so you should think some other branches apart from anesthesia, but I can assure you, if you do it in a good college with a decent amount of caseload, definitely anesthesia will be a very good option for you, right? The second thing, financial stability. I said you in my pros, I said you the financial stability. So what is the other side of the coin? Now I said you anesthesiologists are paid well in the beginning days, but what will happen to anesthesiologists after few years? Our curve will rise up like this in the initial days, and it will become static. Sorry, our curve we started like this. If you take my age, I am putting a graph like this. This is my age and this is my income range. So it starts somewhere like this. It starts at a higher point and it doesn't have a slope like this. But when you take a surgeon, his curve starts like this. So obviously we have a plateau phase. We soon reach to the plateau phase, because that's what the whole corporate world is, right? So what I can tell you is, initially it will give you a good amount, but after few years definitely you will become you will reach to that plateau phase of it. So you can't earn. If you are earning more than that, that means you are costing more amount of night duties, more extra amount of stress you are taking. But there is a capping for the amount what we earn. Even though there are I can do 50 or 60 cases per day, but I can't run around throughout the day, right? So giving spinal anesthesia, doing cesarean section, I can do around 30, or during my post graduation period, the whole day we used to do in government hospital, the whole day and the next day, one single anesthesiologist, the postgraduate resident, when I was doing it, I was handling around some 60 cases the whole day and the next half of the day also. So you can imagine 60 cases or 60 to 70 cases in a day, but I can't run like that. If I run like that, soon I will be in the dead bed. Fine. So that's a very point. So you have a plateau phase which you need to understand it. Fine. As I said but the plateau phase will not be very low. As I said again, surgeon's curve will go like this, but for all surgeons it will not be like this, because for you need to be successful, you have to have some qualities. But for anesthesiologists, okay, fine, you don't have communication skills, fine, you will earn your piece of that, whatever the amount you give the procedure, you need not communicate for it. So that's one point. The next point, I said multiple exposures. I want to become cardiologist, I want to become pediatric anesthesiologist. So I said this is the one pro of it. You can go whatever by it. So what is the con or other side of that coin? The other side of coin is it's not very easy for me. So I was working as cardiac anesthesiologist in the beginning of my post graduation. I have worked in cardiac team, then later I moved to intensive care unit. I have worked there for 3-4 years. Later I have done some trauma and all these things, trauma, transplant, and later now I am practicing pediatric anesthesiologist. Now if you ask me, imagine a situation, I am there in an ICU and a patient comes for a dialysis. I know the patient has to be dialyzed. For some reason he is having dialysis. I know how to put a sheath, I know how to initiate the dialysis. But if the nephrologist is there in front of me, he is trained. He has done his DM nephrology, and I have not trained, I have some knowledge of dialysis, putting a sheath and all these stuff. But when I compare to that nephrologist, I might be lacking, because he has done extensive work in nephrology for 3 years. Now imagine a situation how you need to prove yourself. So when I was beginning of my career, wherever I started, I started with cardiac anesthesia, intensive care, I need to prove it to myself. Whereas I don't know about the rest of the branches, but you also need to prove. But for me, the proving level would be on a much higher side. So I can do an ultrasound, I can decide upon, suppose if the patient comes to me with blunt injury, I can do a fast ultrasound and I can tell that this is the problem there. But to do an ultrasound or to contemplate, suppose if I say there is a trauma or if there is some splenic injury or something like that, if I say, but if an ultrasound sonologist, if he says there is nothing like that, if it is very big, everyone can identify it. But for subtle changes, I need to be so well equipped. That means I should have that much amount of knowledge. That means my subject reading will not end with my 3 years of my post graduation. That is the reason why I will stress, that is the reason why many students think that anesthesia is an end branch. Yes, anesthesia was an end branch when I finished off my anesthesia in 2010 and 11. It was a dead end branch. There was nothing like, when I finished off my post graduation, there was no super specializations. Now in 2015-16, they started DMs. We have DM, pediatric anesthesia, transplant anesthesia, cardiac anesthesia, because everyone has realized that you need to get extensive training, right? So that's the reason why if you think that anesthesia is a dead end branch, I don't want to read, so obviously you might be challenged, and if you are challenged and you are not equipped, that means you will be at loss, you will feel a lot of stress. So that's one of the flip side of the coin. Okay, so when you have multiple exposure, definitely you need to prove to a person who is like trained extensively. Okay, so that's the next point. Fine, I said you don't want to learn more. Okay, don't want to learn more, or don't want, just want to give spinal anesthesia, settle in my district or town, want to earn some 4-5 lakhs. Again the problem comes here, you need to settle. You can't be in a tier 1 city, you can't be wearing that white collar shirt like cardiologist. So you need to settle down definitely in districts or talukas level if you don't want to upgrade yourself. Okay, I just want to learn only spinal anesthesia, sir, and I will live my life. Definitely you have to go to districts and talukas, and might be probably in future, because as you grow older and older, the cardiologist or nephrologist or general surgeon, they will be considered as senior. But as you grow older and older and you do only spinal anesthesia, no, it's not going to work, because the hospitals are equipping themselves more. They are also starting, because in 2010, somewhere around 50 or 60 kilometers from my city, there was no person to give general anesthesia. Now 50 or 60 kilometers away from my city, it's like more or less like a city only. So everyone started doing more or less complex cases also. So obviously you need to update yourself. It's not like if you want to learn only one procedures, earn for a moment of time, that's fine, but still it's going to cost you a lot. So that's the flip side of it. The second one, the next advantage which I said you was work-life balance. Anesthesiologist, you are working in an emergency, you will balance work and life, but unfortunately it's not positive for all the things. Like I have seen many students, as I said you, one of the student was perfectly handling a mob of crowd, but it's not exactly, everyone can't do this. Everyone we are all not trained for these soft skills. So obviously some people might not able to balance, and they might carry this stress to the house, and I have seen so many things that are happening at a personal level, so which might be affecting at a personal level. So you need to master in it. So this is a counterpart of it. You know how to handle it, but if you are not having that much, because we can't, like, everyone is not born genius. You have to learn things somewhere or other. We fail to learn things. If we fail to learn things, definitely we will be on the other side of the coin. So work life balance might be affected seriously. I said you good scope out of country. Yes, obviously there is a good scope out of country, but in the same hospital, I stay in my apartment, so even my the neighbors don't know that what I do really. So that's many people say that's the anesthesiologists, they are unsung heroes, or they work behind the screens. Okay, partly I agree with them, because most of them, we don't like to come out, we don't like to tell or do these things. Whatever we do, we are we do and we go silently. So that's one of the point, that's a negative point of it. But unfortunately that's not completely dead end there. So I want to emphasize there, you want to talk to your patients, you want to speak to, you want to have communication. Definitely take critical care. It's one area, in my critical care part, when I was doing the critical care part I have done it for 3 years. My day started at 8 o'clock or 9 o'clock. I did my rounds up to 10, 11, 12, and the next half, what I used to do is, I used to counsel the patients. I used to tell to the patients what is happening to the patients on a day-to-day basis. That's a very, very strong point. Without that communication skills, you can't, the patient is in ICU, he is spending money, the patient is in a critical condition, and if you don't communicate, off late you might have seen many doctors have been hit. One of the strong reasons is, I personally feel, is we are not trained to communicate with a mob or a bunch of people. You should be very careful in uttering. Whenever you are using the words, you should be very careful, because people are 20 people surrounded by you. So every day I used to sit with the patient attenders, and we used to have dedicated some 2 3 4 hours we used to spend in counseling. Me, my consultant, or myself alone, we used to sit there and counsel the patients. We used to explain to the patient attenders, because whenever there happens to be a catastrophe, it has to be passed on very smoothly. So that's one point. When I say we are working behind the screens, for those students who want to project themselves, we still have an option. Again, I will tell you, working behind the screens. Anesthesiologists, they say that they work only in the OT. Yes, my professor, I remember this. This is a classic example I have seen with my own eyes by professor. We used to work in the government hospital. We used to have this onco postings also, where in oncology ward, people used to suffer with lot of pain. Whatever the medicines you give, people used to cry with the pain. They used to, I have seen, people are not having sleep, adequate enough of sleep, and all these things. So what they used to do is, at the end, or in where somewhere around incurable cancer, they used to call upon these anesthesiologists. What my professor, I'll tell you what a whole anesthesiologist, I'll not tell you, but what my professor used to do is, he used to take us for the rounds. So in that rounds, I have seen the patient with stage 4 pancreatic carcinoma. He is having incurable pancreatic, non-operable. He was suffering with pain. Lot of morphine was going. My professor went there. The moment my professor entered into his room, the patient was smiling. I didn't realize what was this, because he went there. He has given one celiac plexus block. Fine, absolutely fine. The patient had no pain for the next 3 or 4 days. That was an awesome experience. Next day when I saw, he was very comfortable 2-3 days. So pain physician. So people who say that we are working behind the screens, yes, that's right, but there are multiple ways to project yourself. As I said the first statement I have given to you, branch mein nahi, bande mein dam hona chahiye. So this is a classic example of it. So if you want to stay behind the screen, that's fine, awesome, fine, that's also fine. But if you want to come out, definitely there is a scope for it. So good scope out of the country. In the country, the flip side, if you look at it, you will be behind the screens. Most of the times you will not be recognized. That's fine. Okay, the next one, I said you can open up the hospital, you can run through it, but the flip side of it, you are not the real face. As I said just now, my neighbors don't know what I do in the hospital. Unless one of my neighbor had a cardiac arrest, I went there, I have done CPR, I have shifted him personally in the ambulance, I have accompanied them, put a stent and all these stuff. Then they realized, oh, this is what anesthesia. So then they know this is what anesthesia and critical care training is. So now here comes a point where when you have opened up a hospital, you are not the face, because surgeon, if he is operating, he will be seeing the patient in the pre-op area, he will be handling in the intra-op, post-op also, again he will be talking to the patients. So most of the times what will happen is, patients do remember surgeons only. Yes, that's a fact, obvious fact, because he is exposed more number of times to the patient. Okay, the places where I have worked in those kind of places also. I have worked in other places also where anesthesiologists take a leading step, and he has eased the work of surgeons. Surgeon job is to diagnose and post him for surgery. How to optimize in the pre-op area, how to take care in the post-op area, everything will be handled by the anesthesiologist. Now imagine this situation. This is happening in most of the corporate hospitals. Surgeon, this ease of the work, we are not against. Might be you might have seen in your medical colleges surgeons and anesthesiologists fighting. It's like husband and wife relationship. Many people say it, but obviously, even though you consider husband and wife relationship also, what I feel personally, it's an inter-relationship. We can't live without each other. At the same time, we can't live with each other also. But simultaneously, when I ease off his work, I have my particular set of surgeons, those who call me whenever the case is going to be risky. They rely upon, when I say Dr. Saab, this is going to happen to the patient, they give that importance, provided you are having adequate amount of stuff. Just you say suppose if there is a placenta accreta, percreta, and you know how to handle this. You can't say, sir, I will just put a spinal and I will piece off from that place. No surgeons like to call upon the anesthetist, and they will be kept aside. So you have to be trained. You should know what are the implications pre-op, intra-op, post-operatively. So then only you will get it. So what I feel personally, what are the cons that are there? They are like, they are what we feel. So at the end, what I want to conclude to the students is, these are the few things which I have observed. I don't say I can't compile a whole list of it, because whatever the small experience I have, only 9 or 10 years of experience, I can't say master of anesthesia, but whatever the small experience, whatever the observations I have made, I have put it in front of you. Now you have to take a call basing on these requirements, whether anesthesia is suiting to you or not. Remember one golden word which I have learnt in my life of 10 years is, what you get in your life, it all depends on what you give to the department. It's a very, very interesting statement. If you go back again, I am repeating the statement for you. What you give to the department, that is what you are going to get in your life. If you are only giving time, you will get money. If you are putting your energy in the form of application of the subject, learning the new skills, and you are putting time there, you will definitely get name, fame, and also the money. If you are putting the heart, you will win the hearts of the patient. Can you understand it? So that's the reason why we have bunch of doctors there, but only famous doctors are very few, because I have observed very closely that they have put their heart apart from subject, apart from the time, apart from personal gains. They have kept all these things in the department. That is what they are reaping it. So remember this fact, because at a very younger age, like freshly passed out graduates, you might be having that, this branch is very strong branch, this branch is fine, anesthesia is behind screen, मैं क्या करेंगे यार anesthesia लेके, तो पूरा दिन तो we scrubs में बैठा रहेंगे. So fine, for those students I wanted to emphasize, what you put in your branch, whatever the branch you take, every branch has its pros and cons. Okay, so you should not worry about, this is my personal opinion, purely personal opinion, you should not worry about what are you going to get, rather than you should be worried about what are you going to give to the branch. We have a lot of scarcity of research and all this stuff. We have, there is tremendous amount of things in medicine in our country. So if you put your energy appropriately, definitely you will get whatever you have kept it. So with this, what I want, I don't want to take your time also. Too much amount of time is also not good for you. So this is what I wanted to tell to you. So just take a call on it. Whatever your queries, please ping it to me. I will be happy to answer. Thank you. All the best.